So the rationale for the BladderPath study is that the staging of bladder cancer hasn't changed in a century. So for 100 plus years, urologists have been staging bladder cancer by doing an endoscopic resection down to muscle and then assessing whether the tumour goes into muscle or not to split patients non-muscle invasive from invasive bladder cancer. The problem with this is it's quite a morbid procedure. They not infrequently will puncture the bladder. It's also not a very good treatment for muscle invasive bladder cancer. So we hypothesised that we could move to a pathway that's more like most other tumour sites, whereby we would do a biopsy to confirm the histology as being transitional cell carcinoma or whatever, and use a scan to determine the stage, to determine muscle invasion without attempting to do a resection. And then the patient would then proceed in that pathway to whatever treatment was deemed appropriate. So if they're non-muscle invasive, they would proceed to an endoscopic resection. If they were muscle invasive, they might go direct to cystectomy, for example, without a TURBT. So the hypothesis we had was that an image-directed biopsy-based pathway would result in patients getting to their final correct treatment, cystectomy, chemotherapy, radiotherapy, whatever, faster than if you had a surgical procedure sandwiched in the middle.